Thank you for coming to spend some time with me this afternoon. My name is Gretchen Schaefer, and I'm a hospice nurse. I was invited to come and speak with you today on behalf of my friends at Loma University Medical Center, as well as some very close friends of mine at Cornerstone Hospice. Being a hospice nurse gives me a lot of perspective of what it's like to take care of aging parents, which is what I've been asked to speak to you about today. But also because I find myself in a rather unusual predicament. I'm a senior citizen. It may be hard for you to believe, but it's true. I'm 65 years old, and I know what it means to be part of the baby boomer generation. Our generation has done a lot of great things, but it's also changed the paradigm, the shift in what we need to be doing for our senior citizens, because there are more of us now than there used to be. I've also been the caregiver myself for my elderly parents who lived 3,000 miles away. And when they needed help, I have to tell you, even though I come from a medical family, we weren't prepared. So I hope this time together we can talk about issues that help us to be ready to take care of our parents, and also for those of us who are going to need care ourselves. Interestingly enough, never before in the history of our planet have we had so many older people. This has not always been the case, because as late as 1930, America's older population numbered less than 7 million people, only 5% of the population. That's not many. Today, 1 in 3 Americans is 50 years old and older. By 2030, 1 in every 5 people will be 65 years and older. Those aged 65 and older numbered 39.6 million in 2009. You see the change? Before, if you looked at a pyramid this way or a triangle, the very top, which was the smallest, those were our elderly people. And on the bottom, those were the people that were younger, that were working and productive and out in the world making money. Now that triangle is upside down. So the wide is up at the top because of all of our senior citizens, of which some of us here are part of. This rapid growth, as I said, is due to the aging of the baby boom generation. For the first time in history, I think this is interesting, people 65 and over well outnumber children under 5 years of age. Imagine that. It used to be that there were families having large numbers of children. That's all changed. And so the way we have to look at healthcare in our country has changed as well. So we have more people to take care of with fewer people to do it and less money to pay for it. This is what we face in healthcare. And so it's a challenge, but in America we can figure anything out. So I have a lot of faith in the future. The United States actually contains more people over 65 years and older than the entire population of Canada. Can you imagine? The entire population of Canada. Americans now have a decreasing mortality rate or death rate due to the great significant advancements in healthcare. Listen to this. This is amazing. It used to be when I was a young nurse just starting out a couple of years ago, people used to say that pneumonia was the elderly person's friend, because when people died of pneumonia when they were older, it was considered a comfortable way to just kind of dwindle away. But now, with influenza and pneumonia, the mortality or death rate in our country has decreased to only 8%. Why is that happening? Because of all the new antibiotics, all the things in hospice and home health that we do at home, that we used to actually do in the intensive care unit. We do all of these things at home now, which is, of course, where everyone wants to be anyhow. Accidents, the mortality rate is down 5% in this country. Heart disease is down almost 5% in death rate in this country. Loma Linda's been a pioneer in heart transplants and cardiac intervention. A lot that we have to be proud of for our people, our friends over at Loma Linda. The death rate from stroke is down almost 5%. Diabetes used to be a very bad prognosis prognosis for people who had advanced diabetes. Now, people very rarely pass away from diabetes now in this country. It's down to 3.9%. hypertension or high blood pressure, down 2.7. The one diagnosis that still has a very bad prognosis, despite all the years and all the research we've done, is cancer. And the death rate in cancer has only decreased 1.8%, which is why early diagnosis is the key to survival still in cancer patients. Also, it's changed in our country as we live in a fluid society now. When you think about after World War II, when our soldiers came marching home, after all that they had gone through during the war, they just wanted to stay home. It was familiar. They knew people, the family, they wanted to be together. Remember the old movies and the old TV shows from the 50s? The Andy Griffith Show? Remember? Yeah, how can we remember? Because when he became a single parent for Opie, Aunt Bee moved in and she took care of everybody. Nowadays, Aunt Bee probably would have had a full-time job and couldn't have done it because it's all changed. Also, you look at those old movies that they made after World War II when people were longing for days and places of peace in their lives. When you looked at It's a Wonderful Life, that old great Jimmy Stewart movie, George Bailey, remember he had the building and loan? Even though he wanted to go off and explore the world, he stayed there when his dad died to take over that family business. Nowadays, of course, with the baby boomers, our generation is the most highly educated in the history of our country. So those of us who went to school left home to find better jobs and a better way of living. But in doing that, we left those family ties behind. And some of us are looking at that now going, did we really make the right choices? We all have to kind of figure that out. Also, with the collapse of many families in our country, women are forced back into the workforce. And I'll never forget, I never knew anybody who actually was a single parent till I moved to California. And my real estate lady was a single parent. I couldn't imagine how she worked and raised that son and paid the bills on top of it. I've learned a lot since those days, believe me. But even that also, when you feel like in our country that the caregiver is still, it's really a female role. So what happens is when we have an elderly parent or someone needs a caregiver, you might have 10 boys in the family and 1 girl. The girl probably will become the caregiver. So some things haven't changed. Maybe it's because we're better at it, but we won't tell. So the siblings really have an obligation before a crisis happens to figure out what are we going to do for mom and dad when they need help. It's not a fun discussion to have, but I also like to tell people when you're on an airplane, if the pilot says to you, we're going to be approaching some turbulence, so buckle up and you'll be fine, when you know what's coming ahead of you, you can prepare for it and be okay. As opposed to if all of a sudden the thing just drops and you're like, this does not seem like this is a good thing. So preparation is always an important thing. And that I always talk about the family meeting. What are we going to do? Who lives nearby? Who can do what when mom or dad needs the help? If these discussions don't take place ahead of time, oftentimes those emotional things that occur when a crisis happens can drive the family apart. Some families don't recover from that. So preparation and having a plan in place is always the best way to be ready. Yes, go ahead.
Do you suggest having that discussion with mom and dad?
Yes, and I'll tell you why. Good question. Because they're still in charge of their life, and that they need to be a part of it so that we know who the decision makers are for them, and that's a really good question. There are several things also financially that people who become caregivers don't know anything about. And I suggest that people ahead of time meet with a financial planner because, believe it or not, there are things in our tax codes that can help us when we become the primary caregiver or as a sibling when we contribute to meeting the needs of our elderly parents. Also, something interesting that I wish I had known about, when you become a caregiver, if you provide 50% or more of finances that are needed to take care of your mom and dad, you can claim them as a dependent on your taxes. I wish I had known that. I didn't know because I got put in that position. So Also, another good important thing to do is to research estate planning before we get into a crisis. That way everybody knows what their job is and everybody knows what the elderly person's needs and wants are. Another thing that's important to think about is a little thing that in hospice we know a lot about that's called durable power of attorney. Durable power of attorney, that form is very important. There are different types of powers of attorney. There are powers of attorney for health care, and there are powers of attorney for finances. Because if an elderly person becomes incapacitated and their neighbor in their assisted living is signing their checks and paying their room and board, if that's not figured out ahead of time, the elderly person is at risk for fiduciary abuse. Somebody's writing checks on their account and they don't have the legal right to do that. So durable power of attorney is part of the family conference, or what I call the family meeting. And that's why it's important to include mom or dad in that. We need to know what it is that they want. If they have a sudden event, if they fall, they should have a stroke, and the doctors are all telling us different things to do. If we don't know what their wishes are, we could make a mistake. And when you look at the durable power of attorney forms, and you look at the advanced directives, which is another form, it will tell you they can fill out specifically what they want. I got sick myself a couple years ago and never thought I would. And as young as I was, I had to sit there with my son and say, Derek, if these things happen, this is the decision I want you to make. Because when you take that responsibility off their shoulders, they don't live with the grief and the worry like maybe I did the wrong thing. Maybe mom would have wanted me to do something differently. Also, when somebody has durable power of attorney for finances, you can arrange for them to sign on your bank account. In case you're in a rehab center for a couple of months, they can still pay your mortgage so you don't get into trouble. That's why all of these things are important to figure out ahead of time. Oh, go ahead.
Do you need a specific power of attorney for real property? Or is it just
Yes.
specific?
Yes. And all of these forms you can get from a paralegal. You can get them off of the internet. There's another new form that was actually developed in California called the POLST form. And it's POLST. That stands for Physician's Orders for Life-Sustaining Treatment, POLST. And all of us in healthcare know it. It looks like it's hot pink, so you can't lose it. And there again, the person writes down what they want. If this happens, this is what I want. Sometimes what happens is if we don't have this figured out, a doctor in the emergency room who knows nothing about you is trying to figure out what you want, and you can't tell them. So that's why the importance of doing these things is important, so that we know what you all want. I had a patient one time, not too long ago, actually a couple years ago, and it was a young mom who got AIDS from a blood transfusion. Now, her mom was her durable power of attorney. She had young children. And it was very hard because the patient said she didn't want any extraordinary measures because she didn't want CPR and a trach and all kinds of ventilators and things like that. When it came time, when that patient ended up in the hospital, the mother, who was the durable power of attorney, honored her wishes, even though her siblings said, but she's only 32. See? So that's why we need to know what you want and how you want it done. And pick a person who will always adhere to your wishes, no matter what. Sometimes you have a durable power of attorney for finances, and you have a different one for health care. And so you have to think about that. Who do you trust with your money, and who do you trust with your health care? Two different things. When people become caregivers, it's kind of a 24-hour, 7-day-a-week job. And when this happened to my mom and dad in Florida, and I was in California, they sort of expected that I would just be there to take care of them, but I had a job and I had children. So one of my 7 sisters, moved there to take care of them, and financially we all helped out. But even then, the caregiver needs to have a break, because when you deal with an elderly patient, an elderly parent, oftentimes there's confusion, different types of dementia. And because they have these disabilities, it really is very difficult to take care of people like this. So we all took turns taking our vacation and going to Florida so that my sister, the caregiver, could go to a hotel and just kind of have a break. That's the other thing I wanted to talk to you about, some of the illnesses that, that our elderly population deal with. But I also wanted to tell you that if you're taking care of an elderly parent, you can look for caregiver support groups on the internet. You can find them. There's a little book that I brought along called New Lifestyles. Cornerstone Hospice has an ad in here. And you can look for their phone number, because you can always call them if you don't know what to do. And you can find these in doctors' offices, in waiting rooms, and in the hospitals, in different clinics. They have these all over the place. And you can look in there, and you can always make a call, because if, for example, if Cornerstone Hospice can't help you, they'll direct you as to who can, because they have a wealth of knowledge and all kinds of different supports that are available to you if you're in that situation. So kind of write that name down, Cornerstone Hospice. I have a great deal of respect for them, because they go out of their way for patients and families. Every opportunity they can do it, they will. They'll be there to help you. One of the biggest challenges we face in dealing with our elderly parents is confusion. And I remember when I was a kid and we'd be around our grandparents, they'd say, well, she's a little senile, that's just how, well, we don't talk like that anymore, because we know that instead of just being senile or having what they used to call the dwindles, I don't know if you ever remember hearing that, but they just kind of dwindled away. They were just old and just kind of dwindling away. Well, now we know that dementia and Alzheimer's disease are real diseases. And we don't really know what causes them. We have a lot of theories about them, but taking care of an elderly parent that has any mild dementia or moderate or severe is tremendously challenging. What does the future really look like for this population of patients in our country? Right now, we have more than 5 million Americans living with Alzheimer's disease. 5 million. Every 67 seconds in our country, someone develops Alzheimer's disease. 1 in 3 seniors dies of Alzheimer's disease or different types of dementia. In 2013, 15 million caregivers, think of this, 15 million caregivers provided 17 billion hours of unpaid care to their elderly parents. They did that, they didn't get paid. It equaled $22 billion. That's 8 times the amount of money that McDonald's makes every year. Think about that. So think of what that was like, the stress that was on these caregivers. By 2050, the number of people aged 65 and older may triple from 5 million to 16 million people. We got to have a plan. We got to be ready. So I wanted to tell you also, sometimes people say, I wonder if I'm getting Alzheimer's disease. I can't remember where I parked my car at the mall. We kind of all have that. But there are 10 warning signs I want you to be aware of, because these are indicators that we may be in the early stages of Alzheimer's disease. One is memory loss that disrupts daily life. My mom used to do this all the time. I'd go see her and she'd say, my name is Gretchen, and she would say, Karen, shouldn't we be getting ready to go to Mass today? And I would give the wrong answer. I would say, no, Mom, today's Tuesday. We don't have to go on Tuesday. She'd say, oh. Karen, shouldn't we be getting ready to go all day long? She kept saying this. And I kept saying no. So I learned a lot from that experience. I thought I knew a little bit about it. I learned a lot. Because when somebody with dementia, any kind of dementia, asks you the same question over and over again, don't redirect them and tell them the right answer. Just say, oh, okay, we will, because they'll forget about it. Communicating with an elderly person with dementia, Alzheimer's disease, takes a lot of skill, because if you think about it, if you look at the person sitting behind you and you don't know that person, if they're going to all of a sudden take you in and give you a shower, or they're going to help you brush your teeth, you don't know that's your daughter. That's why a lot of people with dementia in nursing homes, they say, oh, she's combative. When we try to help her, she's combative. The reason is because she doesn't know you're her daughter. So when you're communicating with a person with dementia, it's always important to say, hi, Mom, it's me, Gretchen. It's time to go in and get your teeth brushed. See, when you tell them that way, then she'll forget who I am in 5 minutes, but I won't take it personally because she doesn't know. So you always want to keep saying who you are, and also don't ask questions like, do you want to go in and take your shower now? Because they may not know what the shower is. They may think you're talking about going to pull weeds in the garden. So you always want to say, let's go in and do this now. It's time to do this. Then usually they'll go, okay, because they just kind of follow along. If you ask a person with dementia, tell me what it was like or when you grew up in Minnesota. They don't remember that they grew up in Minnesota. So instead of asking them to give you facts, just say things like, I remember when you told me what it was like to grow up in Minnesota. And the Mayo Clinic was there and had the whitest snow in the Midwest. That's what my mom used to say, had the whitest snow in the Midwest. She remembered that. The other thing that's important to do when I took care of my mom because she couldn't figure anything out is I would do things that I knew were familiar to her. For example, the movie Gone with the Wind. Back in that generation of World War II, everyone was in love with Rhett Butler, right? So when I rented the movie and I played it for her, she looked at me and she said, Sarah, he used to be my boyfriend. And I said, I know, he was lucky too. See? The other thing that's important is music. When you play music to an elderly person, they don't want to hear, what's going on with, Ludacris or any of these people that some of us know. But when you play music that they recognize, especially from the World War II era, you will see in their eyes there's a recognition. And I always tell this story. I went to a skilled nursing facility one time, and the activities director was playing music. And there was an old gentleman there, and he was slow dancing with an older lady. But when I went to this music, and the music I remember was I'll Be Seeing You in All the Old Familiar Places. Remember that song? And when I looked at them slow dancing to the music, I noticed that the lady had her feet on top of his shoes. And they were dancing this way. And I was watching. And I said to the activities director, who are those people? And it was the saddest thing. It was a father and a daughter. But they didn't know that they were the father and daughter. All they knew is they recognized the music, and when she was a little girl, she would put her feet on top of his shoes. How many people in this room dance with their dads like that? You see? So that was familiar to them. So when you do things like that keeps them in touch with this world. Maybe it's the world that doesn't exist anymore, but it's their world. So we want to try to be in their world where they're familiar and comfortable. One of the saddest things for parents is when they're elderly and they have confusion or dementia, if you say, tell me about your children, they can't remember. Then they feel bad. So it's good not to bring things up like that unless they bring it up. Okay? So be aware of this when you're dealing with elderly people, that you always want to give them a break because they can't remember, and that's okay. They're just still with us, and they still have value in this world. So we want to honor them wherever they are. That's what's great about hospice is they figure out where the patient and the family is, and they figure out how to meet all of their needs. It's not just the patient that we think about, it's the whole family. And once they become a hospice family, we stick with them as long as they need us. Okay? So I just wanted to tell you about that. Does anybody have any questions about anything I've talked about so far? There are a couple of medications that we use to treat dementia and Alzheimer's disease. Two of the most common are drugs called Namenda and Aricept. Now, these have been around for a while, And there's a lot of research about how effective these medications are. We know that in the early stages of Alzheimer's disease is when they're most effective. And the way they work in two different ways. And I know you're not probably medical people, but sometimes people say, well, how does it work? We don't even know what causes this. How do these drugs work? Well, Namenda, which it was actually invented first, that works in moderate to severe Alzheimer's disease patients. If you get lucky, if you start it early enough when their symptoms begin, and what that does is it blocks some negative effects of a chemical that's normally found in the brain. Okay, so it blocks that chemical in the brain from causing damage, which is what affects your memory. Aricept is a different medication, and what that does is it blocks a chemical that interferes with learning and memory. Sometimes patients are on both of those drugs together, but if you have a mom or a dad that you're starting to notice these symptoms and you're taking them to the doctor, you can bring it up and ask these questions because they're actually quite widely used nowadays to take care of folks who have these types of problems. You know, I'm sure you all remember when President Reagan made the statement about that has had the diagnosis of Alzheimer's disease, and he said goodbye to the country. Well, after that happened, people really didn't know what his life was like. And I knew some of the nurses that took care of him because what he used to do, this is so interesting I thought, is when he was still able to walk, he had a caregiver that would help him get ready every day and go with the driver, and he would go to his office in Century City. And he would kind of putter around in there, and you know, people would come up and say, "Oh, Mr. President, you know, we're so happy to see you," and all that. Well, he had a fish tank in his office. And when he and his wife left the White House, when his term of office was over, the people in the kitchen that he became friends with gave him a little ceramic White House as a little going away present. So he took it. And when he got to his office, you know how in your fish tank there's usually a little castle or something in there and the fish swim around? He put that little ceramic White House in there. So it was in there for a long time. Well, the Reagan Foundation decided that they would like to have an author write a biography about President Reagan. So they searched around to try to find somebody who was neither a Republican or a Democrat that just would write a book about what he was really like. So they found this gentleman, and part of his assignment was to go every day with President Reagan and the driver and the caregiver to his office to kind of see how he interacted with people and what he was really like. So he went with them every day for several months, and then he would go back to the house where they were living in Bel Air. So when one day President Reagan came home, the author was there, and as always, what would happen is Nancy Reagan would meet them at the door. He always had a suit and tie on, and he had an overcoat on because it was cold. She would help him take his overcoat off, and when she tried to take his overcoat off, his hand was clenched like this, and his wrist was wet. And she said, "Ronnie," and she tried to pull his coat off, and she said, "Your wrist is all wet." And then she said, "What do you have in your hand?" And she opened it up, and it was the little ceramic White House. He had stuck his hand in the fish tank and taken it out. And when she asked him, "What do you have there?" he said, "I don't know, but I think it has something to do with me." Isn't that sad? So here he was. He knew it meant something, but he didn't know what. And so this is what the disease does to people. And they feel badly about it. And so she just said, "Well, okay, I think that's just great that you brought that home. I was wondering where that was." See, she normalized everything that happened. The other thing that's important to know is that what people don't know is, is very typical of elderly people, is what happened to him. When he fell and broke his hip, people don't know this. He never got out of bed after that. He was bedbound because people who have dementia and have all kinds of illnesses that people face at the end of their life, they don't heal very well. And so here was this man, even though he went through the surgery, he was never able to get out of bed again. So there again, these are the challenges that people face when they have luckily they had the means, obviously, to provide the care for him. The other thing I wanted to tell you is before I kind of ask you guys if you have any questions is when I talk about hospice, I want to just explain one thing. People think of hospice as just for people with cancer, and that's not so. When hospice was developed, basically we took care of just hospice patients. But there are so many illnesses that elderly people face that do qualify them for hospice care. If you have any question about that, it's always good to ask the question, because would hospice help my mom or dad? Because hospice isn't just about somebody coming to visit. They provide a lot of what elderly people need in dealing with their illnesses, because the goal in hospice is to make the patients feel safe, comfortable, and loved up a lot. And because those are the goals, and to take care of them where they want to be. If they want to be at home, where our job is to help make that happen. And so it takes a team approach. We have physicians and nurses, social workers, chaplains, volunteers that go out and see the patients. We don't take the place of family members, but we provide medications, equipment that the patient needs to be comfortable and feel safe, comfortable, and loved up a lot. The other thing that's important to know is that we provide bereavement services for about a year after somebody passes away. And so if you have any question about somebody in your family, you can always contact hospice. If they can't help you, if the person does not meet the criteria to be on hospice, they'll help you figure out who can help. Okay, does anybody have any questions? I knew you had one.
Well, first of all, the hospice thing I always associated with the end of life,
Right.
like the last few weeks.
Yeah, most people make that mistake.
More long-term.
Well, the rule under Medicare is the patient has to have an approximate life expectancy of about 6 months or less. Now, here's the thing. That's what happens is we get referrals, and the patient's only with us for a couple of days, and then the family goes, we wish we would have known about you sooner. So here's the thing. The key to this whole thing about hospice is that the staff will always reevaluate how your mom or your dad is doing. If they're stable and they don't qualify for hospice anymore, they'll tell you that. But if there's a decline in how they're doing, then they still qualify for hospice. So the medical people will make that determination. But I'll tell you something, so many people say that to me, oh, Gretchen, if we only would have known about you 2 months ago, you could have helped us so much. And so we're there for everybody that we can be there for. We have strict guidelines as set out by CMS. The new health care law has made some changes in the patients that we can take care of. But we follow those guidelines really very carefully, and the hospice people are very well trained. The other thing, too, is that sometimes older folks, when they become very agitated, if they're in assisted living or live in a board and care or even a skilled nursing facility, sometimes people make the mistake of saying they're just agitated. And a hospice person will look at that and say, are they agitated because they're uncomfortable? Because agitation oftentimes is a sign that they're in pain, but they can't tell us. So it's important to have somebody evaluate patients this way.
But my real question was, what's the
Yes.
difference between dementia and Alzheimer's?
Well, there are different kinds of Alzheimer's disease, and your doctor can tell you the difference. There's Lewy bodies dementia. There are some types of dementia that are brought on by a stroke. So they're all different kinds of dementia.
We speak of them almost interchangeably.
Yes, right, because they're so similar. Yeah, dementia, when you really think about it, is how do we find out somebody has dementia? It's interesting because really the only way to really know that somebody has dementia is during an autopsy, Alzheimer's disease. But the way they make the diagnosis is they ask a series of questions, and the doctor can evaluate by just doing those questions. And they're all different stages in Alzheimer's disease and dementia. Very interesting. And you'll see that sometimes people do well for a while, and then they don't do so well. In hospice also, it's important to know that we always follow what the patient wants. Sometimes we love our parents so much, and I've heard people say, well, when you were sick, Mom fed you, so now that she's on hospice, we have to make sure she eats even if she doesn't want to. Well, the patient always knows what they need, so we take direction from what they're wanting and how they're feeling. If they say they want prime rib and they take 1 or 2 bites, that's really okay, because that's really all they need. Interesting, huh? Yeah. Any other questions?
I'll make a comment, because 2 years ago in November, I buried a friend that was 98. And if
Oh.
it wasn't for hospice, I don't know what I would have done. It's beyond, there's angels' wings on all those people that work in hospice. So
Well, thank you.
it really is amazing.
That's nice to say that. We try really hard. And I always tell people that we're never going to walk down a red carpet and get an award for being the prettiest or the best singer. But there are greater rewards than that, because the families need so much help, and the patients. You know, when you think about it, years ago, people would die in an intensive care unit somewhere. They didn't want to be there. So we say we take care of the patient so that they have the most meaningful life that they can have. We enhance the life of that patient in the place where they really most want to be, and that's home. So in my career, I mean, I've hung IVs from the fan. You know, if you have to, you don't have an IV pole, you hang it up on the fan. Just make sure no one turns it on. So we kind of, Dr. Harsanyi, who's one of the great medical directors out of Cornerstone, always talks about it being maverick medicine, because we come up with ideas and things that we can do that other people don't come up with. But whatever the patient family needs, we figure it out. Go ahead.
Through the years of being a volunteer for
Yeah.
hospice, there are many people that I have visited that I've never seen anyone else there to visit them. There's
Yes.
lonely people that don't have in hospice, at least gets to see them.
And you're so right. And you know what's amazing too? So many of because of the families, they're over in Pittsburgh, and it's not their fault. They're working, they're raising children. So it's this demographic thing that's been so tough. So it's really true, the hospice volunteers, we say they're the heart and soul of the whole thing, because they're doing it, they don't even get paid. Can you imagine? They do all of that, and they get so close to these patients, they look forward to it. You know, before, years ago, when I was a real nurse, and before there were a lot of times patients didn't have TVs in their rooms because they would get charged extra for it. I used to have a volunteer that would go to see one of my patients who had been I think a professional football player at one time, and the volunteer would read the sports page to the patient. Now you and I think the sports page, we just throw that thing away, but to him, that meant everything, because he couldn't watch TV, couldn't watch the football game. He couldn't see anymore to read the paper. So that volunteer went every Monday and read that sports page. But it took figuring out that's what meant something to that patient. If you came and read me the sports page, I'd be like, I need to take a nap, I'll see you. But see what I'm saying? That's what I'm talking about. That's the way the hospice person thinks. What do they need? Does anybody have any other questions? I'll see if I'm running out of time here.
You still have time?
I do.
How would you recommend broaching the subject to your parents when it's time for you to go with them to the doctor, because you suspect there's stuff going on, you know they're never
Yeah.
going to say anything?
Sure.
Is there a special way you would recommend to do that straight out, or?
Well, you know what? The way I kind of think the best way to say things is not in a scary way. Because if a person's starting to have these kinds of memory things, oftentimes they don't remember when the last time they went to see their doctor. And you can just say, you know, it's been a while since we went to go see Dr. Harsanyi. let's go and just get a checkup, make sure you get your flu shot. You know, there's all kinds of ways that you can talk about these things. And these good doctors will pick up on these things. You know, they really will. Now, the other thing is that when we talk about hospice, sometimes families will say, you know, I don't really want my mom to know that this doesn't have a good outcome. Of course, they're very protective. But when we talk about hospice, we don't talk about it in a depressing way, because we always have hope that the person is going to feel fine. So we learn to hope for different things. And so it's always with a positive attitude. You know, I worked with one of the ladies, actually, who's here, who used to go and explain hospice in the different hospitals. And she was very positive in the way she talked to the patients. She'd say, you know, your doctor asked me to come and talk to you today. You've been here for a while. You've had all this chemotherapy. You've had all this treatment and all these kinds of things going on. And we can take care of you at home so you don't have to come back in here anymore and go through this. Would you like that? Well, most of these patients have just had it with all this stuff. And the other thing it's important to say is, if you have a problem and you're not feeling well, if you're on hospice, we come to you. You don't have to go to the emergency room and sit there for 8 hours until somebody can see you. You call us and we'll come and help you and figure out what you need. And just the thought of that, people go, oh, I'm so glad, because, you know, it's so much easier on them than to have to go through all of that. Yeah.
And you can go off hospice.
Yeah.
If you feel like you want to go in and have some more chemotherapy,
Right.
you can go off hospice.
That's right. It's your benefit. You own it, so you're in charge. And that's the key. So it's just another layer of healthcare that people really don't understand, but it is a really beneficial program, especially when dealing with some of these very challenging illnesses that elderly parents face. It was so amazing to me when this happened to my mom. I come from a very medical family. Everybody in our family is medical. The interesting thing was, when my sisters were so bad at this that when my mom was in the intensive care unit, those doctors would walk up the back stairs so they wouldn't have to walk past the waiting room and talk to them, because they were so just on top of these poor doctors. So they did what we usually do, is say, can we have one person be the spokesperson? And that's usually the one that's the most sane in the middle of the crisis. So they picked on me, and I would meet them on the back stairs and ask the questions. It was hilarious. These people were all highly educated, but they were bad. Because of the emotions got in the way. Anybody else? Go ahead.
Sorry, I don't mean to.
No, that's okay.
You started out saying there were 10 signals,
Yes.
but I'm not sure. I think we just got to one. I'm not sure. Maybe
Well, see, that's my dementia kicking in.
No, wait, I could have said that better.
No, I probably got my cards mixed up.
You need to teach me to say that better.
No. I think I got off on a tangent. Oh, you're right. The first one was the warning signs about the asking the same questions. I started talking about going to Mass. The second one is challenges in planning or solving problems. Can't solve the problem. Difficulty completing familiar tasks. You know, curling your hair, doing the shower, all of those kinds of things that normally are not challenging. The fourth one is confusion about time or place, not recognizing that you're home or that it's nighttime and you're supposed to be sleeping. People get their days and nights mixed up, like some little babies do. Trouble understanding visual or spatial relationships. That's why a lot of older people fall down, because they think they're stepping on the step, but they miss it and they fall because they can't determine how big of a space they're putting their foot on. New problems with words in speaking or in writing, just kind of like what I just did. I thought I went through all 10. I missed 9 of them. You can tell I have no ego about what I do. Misplacing things. There's an ad on TV about that where the lady leaves her keys in the refrigerator. Misplacing things and losing the ability to retrace steps. I thought that was interesting, retracing steps. When I would try to help my mom walk down the stairs, she'd take 2 stairs, she'd walk down 2 steps and then she would stand there. She couldn't remember to keep going. Interesting. Just automatically you'd think you could do that. Decrease in good judgment about what they say and how they act. Withdrawal from work or social activities. They don't really want to go to the wedding reception. They don't want to go to the grandkids' graduation. The reason is because they're uncomfortable. They're afraid that they really don't know who these people are and come and start talking to them. Here's one that I found really interesting. Changes in mood or personality. Yeah.
That's the beginning, isn't it?
The 10 warning signs, yeah, that were in the beginning. Changes in personality and mood.
Like agitated.
Can be agitated,
angry than
can be angry, yeah. Things that normally didn't bother them. I remember when this first happened to my mom, we had a death and my sister died, and I brought her little children to my parents' house because it was almost Christmas. The little boys were 6 and 4 years old. And what brought on her dementia was a shock. A bad thing happened in our family, and she went into this shock. So when I brought the children to our house in Florida, they were walking through the living room, and she looked at me, my mom did, and she said, "Karen, whose children are those, and when is their mom going to come pick them up?" She didn't recognize, and I looked at her, and I went, oh my gosh. But sometimes when people go through a trauma and they go through shock, that's a protective thing, because if it's so terrible and they can't wrap their mind around it, they retreat into this. And they sometimes, and she never came out of that. She was progressively confused.
So you got hit hard quick.
Very quickly, yeah. She was a lady that spoke several languages and had a photographic memory. But the minute that trauma happened, she very quickly was really lost to the family. And then you have the double loss, because she was always the one that we counted on to help us figure out what to do. So sometimes there are multiple tragedies that you have to figure out how to get through. So thank you, everybody, for coming today. I hope I answered your questions. You were really a nice audience. Nobody threw anything, so I'm way ahead of the game. Thank you.
Funny, right?
Thank you.